Hi, I'm Vince Mahalik, President of the Patient Care Systems Division of the Boehringer Mannheim Corporation, and I want to congratulate you for taking a wise step towards managing your health by watching this program. We are a company dedicated to helping people live the quality lives they deserve, and we believe self-management of your overall health plays an important role in achieving that goal. That's why we continually strive to design the self-monitoring products that are widely recommended by more healthcare specialists than any others. And it's also why we produce this special personal health management series to help you understand what you can do to lead a healthier life. Just as many people are discovering today, you can make a difference in the quality of your life through making the right choices. The In Balance, In Control series is designed to show you which choices are right. Exercise and Diabetes is the 5th program of the series and explains the benefits of healthy and safe exercising. It also covers the basic guidelines for balancing exercise with your meal plan and diabetes medication. You can make a difference in having the healthy, quality life you deserve. This program tells you how. The rest is up to you. We want you to know you can count on us as you begin to make that difference through self-management for better health. And from all of us at the Boehringer Mannheim Corporation, thank you.
Hands up. Defense, come on. Hands up.
A few months ago, someone told Brad he'd have to give up playing on the school team. But that wasn't true. Mike used to stroll from his porch to his backyard to walk his dog every day. He puts more into it now. Sarah has problems with her joints and has to keep weight off her feet, so she used to sit and watch TV all day. She thought she was too old to exercise, let alone go swimming. And me, I'm a typist. Moving my fingers was my only workout. The things I didn't know. Brad, Mike, Sarah, and I all have 3 important things in common. We have diabetes, we're exercising, and we're feeling better than we felt for a long time. I'm enjoying aerobics. I never realized that exercise really could make me feel better.
Good night, Nancy.
Night, Nancy. Good night. And exercising in a group is a great way to meet people. I've made so many new friends, but that's only one benefit. Whether exercising in a group or alone, almost everyone can benefit from a good exercise program, and you can too. Exercise increases muscle tone and strength, increases your endurance or ability to go without tiring, and helps your body become more flexible. It can increase your lung capacity, and it's good for your whole cardiovascular system as well. By that, I mean it helps strengthen your heart and improves your blood flow. Exercise also helps reduce stress and often helps get rid of depression. Basically, when you're on a good exercise program, you're more fit, and you start feeling better about yourself. My doctor said that's what exercise does for just about everyone. But he said it has some extra benefits for people with diabetes.
Exercise can help you control your blood sugar and often can help you avoid possible problems. Basically, exercise helps improve the quality of your life, and that's important. When you control your blood sugar, you control your diabetes. Here's how exercise helps. Exercise can lower blood sugar. Diabetes medicine also makes it go down, while food makes blood sugar go up. Exercise, diabetes medicine, if prescribed, and a balanced meal plan need to work together to keep blood sugar balanced at a normal level. With exercise, you use more energy, and energy uses up blood sugar. Also, exercise increases your body's ability to use insulin. In addition, exercise improves your blood chemistry and cholesterol levels to help keep your blood vessels open. This reduces the risk of heart disease and high blood pressure, improves circulation, and lessens the chance of strokes. Regular exercise over a period of time can help reduce the risk of diabetes health problems, reduce blood pressure, and with a meal plan, help reduce weight. A little weight loss often helps overweight individuals better control their diabetes. Regular exercise done at least 3 to 5 times a week can be of real benefit to most people. But it's important to have a physical checkup before starting. Your doctor will help you choose an exercise program that is best suited to your level of fitness, your health, and your interests. Should you have health problems, your activities may need to follow special guidelines. For example, people with high blood pressure usually choose exercise that does not involve weightlifting, because most forms of weightlifting can make blood pressure go up rapidly. An exercise program needs to be planned for you. I always begin by asking my patients what they like to do.
I like swimming, racquetball, bicycling, tennis, and they all fit into my exercise program to give me variety. But I needed something that was easy to do every day. This girl needs to be walked every day, and I enjoy walking around the neighborhood. And besides that, when I'm away from home, walking is always available to me. I'll show you my daily routine. To start with, I plan my exercise for the same time every day, about an hour or two after a meal, because that's when my blood sugar is highest and exercise can bring it down. Food and exercise can balance each other. Now I need to test to see exactly where my blood sugar level is. Self-blood glucose testing before and after exercise helps you learn how various activities affect your blood sugar. Testing also tells you when it's safe to exercise. Your blood sugar needs to be in control before you begin exercise. If your blood sugar is higher than 240 milligrams per deciliter, delay exercise and test your urine for ketones. If you find ketones, follow your doctor's instructions. Check your blood sugar later. If ketones continue to be a problem, call your doctor. And delay exercise if your blood sugar is below 100 milligrams per deciliter. You need to bring your blood sugar up so exercise won't make it drop too low. And you can bring it up by eating a snack. If you take insulin, there are other times you may need a snack in addition to your meal plan. If you exercise more than 45 minutes or exercise hard, you may need a snack before, during, or after exercise to balance your activity. To know when you need changes in food or diabetes medicine to balance your exercise, it is important to keep good records. Records of test results, snacks, or changes in insulin dose and the type or level of activity. I record all this in my training diary. As most athletes will tell you, a training diary is a great way to chart your progress in physical fitness. And most will tell you that it makes it easier to stick with your program when you have your equipment laid out ahead of time. I'm not talking big money and fancy equipment. I'm talking basics, like a good pair of walking shoes that fit well.
Proper equipment includes loose-fitting, comfortable clothes that go with the weather. You don't want to get too hot or too cold, so dress accordingly. Be sure you're wearing or carrying identification that says you have diabetes. It should be with you wherever you go. Drink liquids before, during, and after exercise to make up for perspiration loss, so your body won't lose too much water. Take something to drink with you, or plan special stops along the way where you can get water. And no matter where you are, you always need to be prepared to handle hypoglycemia, especially if you take insulin or diabetes pills.
Hypoglycemia is another word for low blood sugar. Part of being prepared is knowing the symptoms. Some common symptoms of low blood sugar are sweatiness, cold, clammy skin, shakiness, irritability, nervousness, personality change, headache, blurred vision, weakness, numbness, or just feeling different from usual. Slower responses are what you might notice first, so be aware they're a symptom. Stop exercising and test when you first think you may be getting hypoglycemia. If the test shows your blood sugar to be low, treat it immediately. And if you can't test, treat it anyway. To treat hypoglycemia, eat an emergency food, like half a glass of orange juice or glucose tablets. Wait 15 minutes and test again. When the blood sugar is normal, and if it's more than half an hour until your next meal, eat a snack, like crackers.
Exercising or not, you should always have an emergency food available. And money for a phone call, anytime you plan to be away from home. Of course, the best thing is to prevent low blood sugar in the first place. You can help prevent it when you keep your food, exercise, and diabetes medicine in balance.
If you take insulin injections or diabetes pills, take only the prescribed amount and take it at the same time every day. Then, exercise when the medicine is not peaking, not working at its strongest. It's a good idea to exercise at the same time every day, but when that isn't practical, you can learn to work out a plan. At those times, it may mean changing your eating pattern, or with your doctor's approval, changing your insulin. Of course, testing your blood sugar to be sure food, exercise, and medication are in balance.
All right now, she's bringing us back to the main point. Exercise is to be enjoyed. We have good reason to go out and have fun. Whatever your exercise, begin with a warm-up. The warm-up period gets your heart, muscles, and ligaments ready for harder work, helps loosen them up, and helps prevent dizziness and injury. You'll want to do some sort of stretching, flexing, or rotation activity for 5 to 10 minutes. Less if your exercising period is short, as it will be when you're just starting your program. Warm-up for walking can be slower-paced walking, then gradually increase the pace. Be sure to hit with your heel and roll to your toes as you walk. The basics of an exercise program are warm-up, getting the muscles ready for work. Intensity, how much effort or how hard you exercise. Duration, how long a time you exercise in one session. Frequency, how often you exercise. And cool down, tapering off the activity to gradually bring your heart rate back down to normal.
Mike worked up gradually from a leisurely pace in exercise to a more intense pace, and with his doctor's approval. Most types of exercise can be done at 3 intensity or effort levels: a mild or leisurely pace, a moderate or more energetic pace, or an intense competitive pace. A leisurely pace is very good for you. A moderate pace brings your heart rate up for aerobic benefits if you maintain your target heart rate for 15 minutes or longer. And if you're physically fit, a more intense pace may appeal to you. Moderate and intense exercise both offer the same aerobic benefits. Leisurely, moderate, or intense, it depends on your health and fitness which effort level is right for you. Whatever your type of exercise, do it in a way that uses your whole body as much as possible. Even when walking, keep your back straight, your head up, and swing your arms. This exercises your upper body as well as your legs. And always have plans for bad weather, such as doing calisthenics, leg lifts, or arm reaches at home, or using exercise equipment if you like. The main point is to exercise often, at least 3 times a week, but 5 is ideal. If one of your goals is to lose weight, work toward longer, not harder exercise periods, at least 5 times a week. And have patience. Weight loss takes time, and it means following your meal plan as well as your exercise program. Exercise is even more enjoyable when you can do it with a family member or a friend. Besides being more fun, it can help keep you on a regular schedule. Tell your friend that you have diabetes and explain what to do should you ever have signs of low blood sugar. An exercise guideline to remember is never to exercise until you're worn out. Don't go until it hurts. And stop if you become short of breath. And of course, stop if you have chest pain, feel faint or dizzy, or feel that your blood pressure may be getting too high. Remember, you want to slow down from full aerobic activity before you're tired out. End your exercise sessions with a period of cool-down activity. Cool down allows your heart rate to return to normal gradually. Cool down is as important as warm up and should also last about 5 to 10 minutes or longer when you're in your full exercise program. Continuous slow walking or stretching exercises are examples of cool down activities. Flexing and rotation. After exercise, be sure to check your feet for rubbed places or blisters. You may not always feel it, so it's important to look so you can help prevent infection.
Test your blood sugar again after exercise. When you're beginning an exercise program, or any time you change it, test more often to see how exercise is affecting your blood sugar. Remember, exercise can bring down blood sugar several hours after the activity. If you take insulin and you exercise in the evening, you probably will need to increase your bedtime snack. You should test your blood sugar after exercise, an hour later, and at bedtime, to be sure it isn't dropping too low. I talked about goal setting. One of my goals is to exercise 5 or more days a week. If I reach my goal, I give myself a little reward, but not food. My reward this week is going to a movie. But if I don't reach my goal for a couple of weeks, hey, I don't give up. I just try again. This isn't a matter of all or nothing. Even a little exercise is better than none. Now, let's get back to the basics. Exercise after a meal if possible. Test your blood sugar before and after exercise so you can learn how to balance your food, exercise, and diabetes medicine if prescribed. Also test at bedtime. Remember, fitness can be fun. Make it that way by choosing something you like to do, and then dress for it. Carry an emergency food and know how to prevent and treat low blood sugar. Start your activity with a warm-up. Start easy, perhaps with only a few minutes of exercise every day. Then gradually work up in effort and time. Set realistic goals and give yourself rewards. Exercise every day that you can, remembering that at least 3 to 5 times a week will bring greater benefits. If you miss a couple of weeks, don't give up, just start again. At the end of each exercise period, do cool-down activity before stopping. When you make exercise a dynamic, enjoyable part of your life, you're going to feel better, and you'll have better health. Isn't it great that something so much fun can be so good for you?
Corporation is dedicated to helping you self-manage your diabetes by providing you with innovative, accurate, and easy-to-use blood sugar testing products. The quality of your life is important, so Boehringer Mannheim has designed a complete line of self-testing products to fit everyone's lifestyle. The newest generation of the Accu-Check monitors, the Accu-Check 3, and the portability and economy of the reliable Tracer 2 monitor. The Accu-Check 3 is the simpler, smarter, smaller monitor from Boehringer Mannheim. The calibration procedure is so simple. The smart display and memory even show the date and time of each test. And the overall size is also 1/3 smaller than previous models. But most importantly, the Accu-Check 3 monitor still uses the same proven and reliable ChemStrip BG test strips.
For the accuracy more hospitals choose, Accu-Check and ChemStrip BG.
The best value under $50 is the Tracer 2 monitor. Its compact size lets it go where you go. The performance of the Tracer 2 and Tracer BG test strips gives you the confidence of knowing your blood sugar is in control, wherever you are, whatever your lifestyle.
For great value and convenience, there's only one choice. Tracer 2.
Ready?
These products are only a few in a whole family of Boehringer Mannheim personal health products. Ask your doctor, pharmacist, or healthcare professional for advice on the best ones for you. For more information on other products from Boehringer Mannheim Corporation, call toll-free 1-800-858-8072. Boehringer Mannheim Corporation, helping you live a healthier life.